Good evening and welcome to the Pitt County Board of Health meeting. I'd like to call this meeting to order and appreciate all the members of the Board of Health being here tonight. And we may or may not have a quorum. I'm not sure. What do you think, John?
I think if you've got 6 out of the 10 seated, I believe that's a quorum. Is a simple majority, Mike?
So there's 6 of us here. So 1, 2, 3. Yeah, we're good. All right, good. So we have an official meeting then. And the first order of business is to ask for public comments. Anybody want to make any comments? All right, hearing none, we'll move on to our next order of business, which is to approve the minutes. And in front of you, you have the board minutes from June 14th. Thanks to Lauren for putting these minutes together. And we'd ask you to take a minute to look at the minutes, and then as soon as you've had a chance to look at them, a motion would be in order to approve these minutes.
So move.
Second.
So it's been moved and seconded to approve the minutes. Any discussion? All those in favor say aye.
Aye.
Any opposed? All right, thank you very much. Marcia, fiscal report, please.
How's everybody tonight?
Doing well.
Okay, so this is our first period 1 for our new county fiscal year. It's actually the second month of our state programs because the state programs start June 1, which kind of settles out usually next month because of the county closing out their fiscal year. But overall, we have a $13,782,000 budget that was approved county commissioners back in March, April. And since then, we've already had 2 budget amendments. We returned the Advance and Equity AA in the month of July. We returned that back to the state. That was $67,000, almost $68,000. And then WIC received some additional funding for some of their numbers for this area, which brings our overall approved budget at the end of July at $13,716,562. In a perfect world, we should be about 1 month into our 12 months. We know that due to timing items, that's never going to happen in a perfect world. So we had a couple of interesting things. So July, you've got a holiday, you've had a lot of people on vacations. With Epic, we realized that a lot of the payments we were getting in July never left Epic. It never got to the third party, so we thought it was the PHPs just not processing things because there's so many things are happening at the state level. It was actually a glitch in Epic during the upgrade. So we received almost all of our payments for July on the 28th of July. So it was a lot of frantic, because once we get those deposits, we have to separate it out, us with EMS by MPI numbers, and then we have to separate the payouts by programs. So we had one document that was about 400 pages long that we were trying to break out into payments. So our clinic did have money, but it was very, very weird. So we're hoping that will even out next month. It was just the timing of the Medicaid. We had environmental health. They had client fees to come in, and we also had some of our contributions for our Smart Start child care consultant program through the Vidant Foundation. We received that as well. So we have our timing item. We did not receive any county funding yet, which contributes to the biggest deficit. We do have some encumbered items. So the first month we're operating at a deficit, but I think it should all shake out next month with all the timing items we've had. So, and then you will see a lot more AAs this month because all of the COVID AAs from the state, we just received those, and they'll be on AIMS in the next meeting. So lots of moving parts for the first month of the fiscal year.
Thanks, Marcia. Any questions for Marcia? So a motion would be in order to approve this fiscal report.
So move.
Second.
It's been moved and seconded to approve the fiscal report, in which stands without objection stands approved. Thank you, Marcia.
Thank you.
Next is old business, and you'll have in your packet. So as you know, last month, we heard about a proposal to distribute the ARPA funds, and the board voted unanimously in support of that proposal, and we took y'all's letter, thank you very much for drafting it, and we sort of put it into two parts. One was sending the results of our meeting to the commissioners, and then the rest of the letter where we put the background and why the Board of Health is in support of the hazard pay and use of the ARPA funds is on the back. And I know this was put in a packet to the commissioners, but what will they do with it after that?
It would come to a request when the board considers any offer funding, and when they'll be doing that at the earliest in September.
How will we make sure that this gets considered or part of what their consideration?
I can make sure that
That'd be great. Any questions about this?
Looks great.
Great.
Thank you.
Thank you. All right, next is client satisfaction survey. Ms. Schwartz?
We had a swap on that one.
We did.
Oh,
This is Jennifer Hardy.
Jennifer, thanks for joining us.
Jennifer told me she couldn't come, and then she decided she could, and I never got back to Lauren to change it on the agenda, so that's my fault.
I told Lauren today, I said, sorry about it, but it is going to be me. I did think that I had a conflict tonight, but I was able to get that worked out. This is the results from the 2021-2022 Client Satisfaction Survey. We have a one-page survey that we give to clients who are using services of the health department. And this is what they had to say about us for that year. A little bit of background, we had 217 surveys that were collected during the fiscal year of 21-22 compared to 874 during fiscal year 19-20. You'll notice that there's a year missing, and that was during the COVID pandemic, and we did not collect surveys during that time because we did not have a lot of in-person services happening. So we don't have any data for that time period. We were in emergency response. And so, and the reason why the numbers are a little bit low, well, they're a lot lower, are because we were just getting back into the swing of things, starting to collect surveys kind of towards the end of the year. So there's not a whole lot, but I expect more next year as we start to pick up services in person. Policy does state that surveys are distributed during 1 week a month by business office staff and then 1 week per month by WIC staff. So they choose different weeks, and one office will hand out surveys, and then the next week someone else will hand out surveys. I'm also able to send anyone who wants to do it online the actual survey link through SurveyMonkey, and they can enter in their own data. But if not, they get a paper survey in clinic. And then we also have those located in our main client waiting area, and they can complete those at any time. So just for the different questions and some of the breakdown, you'll see that we do ask gender, and the majority of the patients that we do see are going to be female. And so that was almost 77% of the people that completed the survey. As far as age range, our largest age range was 20 to 29 with almost 49%. And then 12 to 29 was our second most popular age range. Actually, no, sorry, 30 to 39. For ethnicity, Black or African American make up 67.7% of the clients that filled out their survey. 14.29 were white, and then about 8.3 were Hispanic or Latino. What services did you receive today? The largest number that we received were going to be split between communicable disease and family planning. So you can see 28 and then like almost 30%. Did the services meet your needs? Yes. So 92% said that we did meet their needs. We got a 0 that said no, so some of the ones that you see are no answer. So It's about 8%. Time between making appointments and being seen, we do that on a scale of great and then to poor. So 84% said we were great, 13 said that we were good, 2% said okay, and then we had none in the fair or poor category. The hours that our clinic is open, great was listed at 86%, good 12, almost 13%, and then a few in okay, and then none in fair or poor. The location of the health department, about 84% said that it was great, about 13% said good, about 3% said okay, and then there was one fair, and then none for poor. Time spent in the waiting room, 77% said great, said great, and then 18% said good, 3% said okay, and about 1% said fair. The time spent in an exam room, 77% said great, 17% said good, 3% said okay. Time it took for my services to be completed, 79% said great, 17% said good, and then 2% okay. Clinic providers and friendliness of staff, 90% said great, and then about 8% said good, and almost 2% said okay. Clinic providers showed me respect, listened to me, took enough time with me, answered my questions, clearly explained what I wanted to know. 92% said great, 7% said good, almost 1% said okay. Clinic providers clearly explained procedures, diagnoses, treatment, and medications. 91% said great, 7% said good, 1% said okay. Clinic providers gave me educational materials that were easy to understand. So 91% said great, almost 7% said good. Clinic providers told me about test results in a timely manner. So about 87% said great, 9% said okay, almost 1% okay. 9% good, 1% okay. Other providers, they wanted to rate the friendliness of staff. 83% said great, 7% said good, 1% said okay. Other providers answered my questions, clearly explained what I wanted to know. So 84% said okay, and then 5% said good, 5% said good, 1% said okay. And then other providers gave me educational materials that were easy to understand. 82% said great, 6% were good, 1% were okay. Interpreter services, the friendliness of staff. 73% said great, 6% said good. A lot of that does not apply to me because they did not need a Spanish language interpreter. For interpreter services, clearly interpreted the procedures, diagnoses, treatments, medications that my provider shared with me. 73% said great, 7% said good. Again, we had quite a few that said does not apply to me. For our registration support staff, the friendliness of staff, we had about 85% that said great, 7% that said good. Registration support staff answered my questions clearly, explained what I wanted to know. 85% said great, 7% said good, 1% said okay. Cleanliness of exam rooms, 88% said great, 7% said okay. 7% said good, and 1% said okay. And then cleanliness of the building, the waiting room, the bathrooms, and other. 88% said great, 7% said good, 1% said okay. And then confidentiality, which is huge to us, keeping my personal information private. So 89% said great, 7% said good, and 1% said okay. So we presented this at our staff meeting on Friday, and some of the next steps that we gave were to keep up the great work, keep collecting the surveys, encourage clients to read the survey and only answer questions that apply to them in their visit. Have some issues where people will get just a few questions in and they'll start with the line and go all the way down to the point where they're saying yes, that they used an interpreter and their services were fantastic, but they speak English. So they're not really reading a lot of the questions. So I do plan to get a group together to revise the survey and try to make it a little more simple and possibly separate it into a few different surveys instead of one big one, because it is a full page. So, and I also gave the staff members a link to the SurveyMonkey dashboard, and if you all would like that, I can send that as well, and you can see all of the answers for yourselves. Do you have any questions of me?
Any questions?
I do have a couple
Go ahead.
questions.
Okay.
Jennifer, thank you for that. It was a lot of information, good information.
It is.
Just curious about a little of the data behind some of those responses.
Mhm.
So the question about the location of the health department, did you guys look at all at those who responded that the location was only okay or poor? Did you look at where those folks resided? Is that part of the survey at all?
It is not.
Okay. What about that wait time between making an appointment and being seen? Do we have an idea of how long people waited?
No, they don't put that. They just put what they're satisfied with. Now, if somebody is real, a lot of times you get a lot of open-ended questions answered when people are angry.
Sure.
And so you'll get some of that, like I waited, 45 minutes to get in. But I don't have an exact time of the amount of time that they waited.
Okay. Well, understanding that there's some limitation then to how much interpretation you can do with those responses, what's the plan for how to use this data going forward?
For each of the divisions to look at where they have suggestions like friendliness of staff, make sure that their staff are trained and have good customer service skills and things like that. Just making sure that we're available and trying to do the best that we can as far as like being, timely, but we do have staff shortages, which I'm sure Dr. Silvernail will speak about shortly, but I think they're all doing as much as they can do. We had a lot of good comments as far as some of the open-ended questions. Not as many as we normally get, but they were all positive. It was keep up the good work. They named some of our staff members for helping them. And so we kind of gave kudos at the staff meeting.
Okay, thank you.
Mhm.
Thanks. Any other questions?
I only have a comment. This was
Okay.
a lot of great information, and my question was around the availability of the open-ended questions. So I'm glad that you have that information and can use it to improve services. So thank you.
I do, and like I said, I can share that with you in the link, and you can read all of them if you would like. There's also how did you find out about the health department, and the majority of what we see is friends and family. They've been coming here their whole lives. Mom told them about it, that kind of thing. So I'll be glad to share that. I'll send it to Lauren.
Thank you.
Any other questions? Thank you, Jennifer.
Thank you.
Appreciate it. Do we need to vote to receive that or accept it or approve it, or probably not?
Just this information.
I think for us, it's an accreditation benchmark that we present that to the Board of Health. I'm not sure that you need to formally accept it. I don't know that it would be wrong to do that, but I don't think you have to.
Okay. Thanks. Next up is Health Director's Report, Dr. Silvernail.
I want to know if that's Jennifer's dog in the picture.
It is.
There we go. All right. Good evening, folks. I guess I can roll. There we go. Dental program. Wanted to update you on our dental program. We talked at our last meeting about our previous dentist having resigned and how difficult it would be to fill that position potentially. Last week, we interviewed a candidate for our dentist position. We were very pleased with this individual and are in the process of making an offer to that individual. And I've got to give kudos to Marcia Hall. for encouraging this individual to explore practice opportunities with Pitt County Health Department. Apparently this individual lives in Marcia's neighborhood, and Marcia went down the street after the individual and accosted her or made contact with her at the individual's mailbox. So,
I'm pretty sure that's called recruiting.
yeah. Well, Marcia's just a bundle of energy, and she went charging down the street after this individual and said, "Hey, you need to apply for the job." So thank you, Marcia. COVID data, I'm the COVID king or the monkeypox king these days. I'll be glad when COVID goes away and it's just a bad memory for all of us. But I like to take the opportunity to walk it through with you folks, and I know eventually folks do watch this either live or recorded on YouTube. So to put the data out there for people to see. This data is publicly available on the state website. At least the vast majority of it is anyways. And but I do want to take a few minutes and share that data with you. So start out with a look at the ECU Health variant surveillance across the region. The colors here get a little bit difficult to read, so I'll give you the breakdown of numbers. But you can see this sort of lavender color here is the BA5, and that is coming to dominate our region as it is around the world. When you look at the raw data for sequenced samples over the last 2 weeks, 191 samples were eligible to be sequenced or of quality that allowed the sequencing. 5 of them were the BA2, 39 were BA4, 140 were BA5, and you can see it's about 3/4 BA5, about 20%, just over 20% BA4, and still about 2.5 or just a little over 2.5% of the BA5 hanging around. This is fairly similar to the last percentages we saw for sequencing, so some stability in the variants is really good for the region. When you do see this virus or are infected with this virus, there's at least some short-term immunity from it. We're not sure about long-term immunity yet. This is the ECU Health inpatient. This is for the whole region, all of the ECU Health hospitals, not just the medical center here in Greenville. And you can see since last report, when I did this for the commissioners a week ago or 2 weeks ago, we were up at about 157. We're down at 149 today, and that's across all ECU Health facilities. 17 in the unit, 4 on ventilators. So again, it's interesting to look at this and how flat the ICU line is in comparison to the overall admission line. Again, suggesting that maybe this virus has attenuated a little bit on average, although still making some individuals very sick. This is our Pitt County epidemic curve by race and ethnicity. I did not show you the congregate living setting curve. There's been so little activity in congregate living, I didn't know that it was helpful, but this is the start of the pandemic. This is the first summer. This was the ECU spike. This is the midwinter spike of Alpha in the first season, the spring wave of Alpha, Delta, Omicron, and then this is Omicron BA5. And again, you see how steep we went up with the original strain of Omicron and how sort of flat this has been with Omicron BA5. It looks like, we'd kind of been on the plateau here with a little bit of down and then kind of a pickup at the start of the summer vacation season. And then we had a jump about 2 to 3 weeks after the 4th of July holiday. We've come back down on that curve. Interestingly, especially in African Americans, where African Americans have kind of surged, that's the red in the graph, with each of the succeeding wave, African Americans have really been kind of flat through BA5. And I don't know if that's because there's been so much more COVID in that community on average, or because I see a lot of African Americans are diligent mask wearers, and if you're very diligent in your mask wearing, maybe that helps in some settings. I think overall masks are probably not real effective against Omicron, but for real diligent maskers, there may be some benefit to that there. But we haven't seen quite the uptick in African Americans as we have in some of the other ethnic groups. Here's the epi curve by age, and we're still seeing this in that 25 to 49-year-old age group is really the sort of the young adult workers are by age the group that is bearing the bulk of the COVID disease here in Pitt County. Excuse me, this is a comparison of, this is off the state website, and the state website updates on the Wednesday. They collect data from Saturday to Saturday, and then they take a couple days to process that, clean it up, analyze it, and then the state website updates on Wednesday around noontime. So this is actually from last week still. And you can see again, here's the start of the pandemic, here's Alpha, here's Delta, here's Omicron, here's Omicron BA.5. And you can see we've sort of been on, at the state level, this sort of little bit of an undulating plateau for the summer. But when you look at deaths kind of follow. So here, this is all pretty much Alpha. These are the Delta deaths, follow the Delta curve. Here's the Omicron deaths that kind of follow the Omicron curve. But in BA.5, we've seen deaths tick up a little bit, but again, be pretty flat. And although at the end of this, the data still hasn't filled in, it looks like maybe even a little bit of a tick down here in the last week or so. So again, maybe some evidence that this on average has attenuated for folks, but obviously still can make some individuals very ill. And then here's our Pitt County testing curve. Height of Omicron, we did in excess of 12,500 tests in a week. Our percent positivity has ticked down. We were over 30%. The number of tests have been relatively flat, around 2,500 a week. Maybe a little drop off at the end here. That's just after the Vidant or ECU Health site, drive-through site had closed. The state site that we had here closed on the 11th, I believe was the last day of collections, but a relatively constant volume of testing still being done in the community. Testing-wise, we've been working with the North Carolina Department of Health and Human Services and OptumServe to reestablish a vendor-sponsored testing site here in Pitt County. We are close to having that happen. We've got some details to work through with the vendor. There will be no charge at the testing site. Again, the state's going to pay for this. This will be a free testing site. There's some talk about should we do a coach bus, and if we do the coach bus option, we may also, the bus would be divided, and there'd be a compartment for testing and a compartment for vaccination. We're probably looking at doing a fixed site right now, but the state has been pushing to get a mobile unit into eastern North Carolina, and they'd like to have that spend some time in Pitt, Edgecombe, Martin, Tyrrell, and Washington counties, sort of the four counties here. We'll see if that actually happens or not. But we are working on reestablishing a free testing site for the community. COVID-19 vaccinations. Here's our breakdown, and this is as of last Wednesday. Again, data is reported out by the state on Wednesday, so it goes Wednesday to Wednesday. The one-dose group, folks who've had at least one dose, 103,927, or 58% of Pitt County residents have received at least one dose of COVID-19 vaccine. Completing the primary series, 97,764 individuals, or 54% of county residents have completed the primary COVID-19 vaccine series. And having received at least one extra or booster dose, 50,394 individuals, or 28% of the Pitt County population. So numbers continue to slowly tick up in our vaccination series. We're doing maybe across the county around 700 a week if you look at the raw data. At the health department, we have vaccine that's been formulated for individuals from 6 months through 11 years. That's the Pfizer-BioNTech vaccine. We have vaccine that's been formulated for individuals 12 and older. That's our Moderna vaccine line. The age on Moderna was dropped from 18 to 12. Below that, we needed to provide Pfizer as an option for folks seeking for younger children. We recently received a supply of Novovax. There had been some questions before about Novovax. This is the recombinant protein-based COVID-19 vaccine, not vaccine. This is for individuals 18 years of age and older. It provides an option for folks who can't take the messenger RNA vaccine. The mRNA vaccines do have some polyethylene glycol in them. And it's a rare allergy, but there are some folks who are allergic to polyethylene glycol and can't take the vaccine. So they were excluded by allergy to a component of the vaccine. This does not have the polyethylene glycol, so can be given to those folks. There's some folks who did not want to take a messenger RNA vaccine, seeing that it is a relatively new technology, and wanted a more traditional vaccine. This provides a more traditional vaccine option for those individuals. Since this vaccine has been provided to us through the federal procurement system, there again will be no cost to the recipient to receive the Novovax if they choose to get Novovax from us. Novovax is a two-shot series, day 0, and then depending on the individual's immune status, it may be anywhere from 3 to 8 weeks to get the second dose. For those with immune compromise, it's recommended that they get the booster at 3 weeks. Those without immune compromise may wait up to 8 weeks to get the booster. Monkeypox, our second declared public health emergency. Yes, Pitt County did identify one case of monkeypox. The infection was not acquired in Pitt County. When we interviewed the individual and did the contact investigation with the individual, we did not identify any exposures to Pitt County residents, additional Pitt County residents. At the request of the state Department of Health and Human Services, we did not do an immediate press release about it, although I did tell the commissioners that we had a case in the county, more or less a case. We did not have the actual lab. We had a report in NC Eds. We had interviewed the case. We were pretty sure we had a case, that this individual met the case criteria. The lab result came the next day, so we confirmed that we had a positive lab report from one of the commercial labs the next day. So it populated the case in NC Eds without the lab results. It's funny how the data flows sometimes. We wanted to make sure we actually had a positive lab before we said we had a case. So we did. That case has been reported. It's visible on the state monkeypox website. In the last couple of weeks, there have been cases that have crept up. In Craven County has, I think, 2 cases now, and one of the northern counties, RCH territory has a county. Is that Chowan County?
Hertford is
Hertford.
RCH.
Okay. One of the more northeastern counties has a case now. I've personally tested several individuals for monkeypox. I've sort of become the monkeypox king right now at the health department. So individuals seeking monkeypox testing, I have done their evaluations and done the sample collection. So not a hard procedure to do, but know that some of my staff have had some fear between COVID, between monkeypox, and just felt like I would take that on as long as the numbers remained low and manageable. So we do have a standing order that would allow us to pass that off. We haven't decided if we're going to allow our enhanced role nurse staff to collect that or not. We're going to look at that going forward. Monkeypox vaccinations, we are serving as the vaccine hub for the Jynneos vaccine here in Eastern North Carolina. Because of the vaccine being shipped directly from the SNS, they wanted the state to limit the direct ship sites to 5 sites. We were one of those 5 sites chosen or requested by the state, and yes, we did volunteer, or I volunteered to do that. We've supplied a number of local health departments across the east with vaccine. I can get you details on that if you'd like to see that. In the county, we've shared vaccine with ECU Health, or the former Vidant Medical Group, one of the practices there. That would see at-risk individuals. We've provided them with vaccine. We are working to get some to the ECU physicians, Dr. Paul Cook's clinic, what used to be the ECU Infectious Disease Clinic, some vaccine there. And also going to get some to Student Health Services at ECU so they can take care of folks on campus for us with vaccine. John,
these people that come to get tested for monkeypox, do they get vaccinated?
If we believe that if they're a patient under investigation, we wait until we get results, Herb, so we wouldn't vaccinate them if we thought they had monkeypox. If they test negative, yes, we'll offer them the vaccine and go ahead and provide that vaccine. I did have one individual who really didn't meet criteria, who did not have a rash or skin lesions compatible with monkeypox that we chose not to test because this individual did not have lesions that we could actually test and send to the state lab. Again, the risk factor profile was not right for that individual, so we did not provide vaccine to that individual. We did, in one case, have an individual we tested, and the partner was with that individual, and we did provide vaccine to the partner. And then when we get results back on the case or potential case, we would vaccinate them if they're negative. There's no role for vaccinating the individual once they have the infection. If we give it within 4 days of exposure, we would probably prevent the infection. If we get it into the contact within 14 days of exposure, we would probably lessen the severity of the disease, provided they haven't developed it. Incubation can be up to 17 days reported with this. Other questions about monkeypox? No? I see you're writing very busily there.
I am. I'll hold.
You'll hold? Shortages, couple of shortages, just to update you on. We're still, blood tubes are, not that we don't have them, but there's a limited supply of those, particularly with serum separator tubes. Infant formula, Gerber Good Start, Soothie is scarce throughout the state. Enfacare, Enfamil 22 calorie is difficult to locate. Other Gerber products are in relatively adequate supplies. Anti-tuberculosis medications, we do have a reasonable supply on hand. We do not, knock on wood, have any active cases under treatment at the moment. We are only treating new converters with a known exposure to an active case, or other certain settings where it would be appropriate to treat that latent TB now rather than to wait. So we are working through that. Our workforce, I apologize, Jennifer did not get a summary of positions out, so vacancies as noted. Usually Marcia does that. I don't have the vacancies noted and did not count them up for tonight. I hate to jinx ourselves. We're close to, in environmental health, we're close to being fully staffed in environmental health. 1 or 2 vacancies in environmental health. WIC, we're, I think, close to being fully staffed there. We had a new nutritionist start this week. I think that filled out WIC. It's our nursing where we're still struggling, as everyone is, with staffing in our nursing positions. We're struggling there. So our vacancies, we've really reached the point where, some of the non-mandated services, some of these COVID AAs that we just don't have staff to provide, I've had to say no to. I simply don't have the staff or the resources to do some of these projects. We've returned some non-mandated agreement addenda. I've refused to accept some agreement addendas that are not mandated services. And there's no point in accepting this funding if we can't meet the deliverables. And the COVID AAs, because the federal government has just poured out so much money, the financial tracking on this is driving us all crazy. The reporting requirements are driving us all crazy. And granted, that's a short trip most days, but it really is quite cumbersome in the reporting. We will be attending a job fair this fall, sometime in September, on the ECU campus. That'll be a county-wide effort, and our department will be represented at that. Restructure, I did send Dr. Garrison some more detailed notes about this. I didn't want to take the time tonight to discuss that. I thought that would be better discussed at our September meeting. But at the manager's request, we've begun discussing and looking at some restructure plans for the health department. The premises and overall restructure concepts were presented to our staff at our general staff meeting last Friday. So far, I haven't heard too much grumbling about it. I'm sure there's some out there, but none that's risen to my office yet. The manager really asked every department head, not just me, but every department head in the county, to look hard at our longstanding vacant positions, to say, hey, can you reclassify them to something else that you can fill or use? Should you abolish that position? Is that something you still need? Or can you develop a strategy to actually fill that position if it's a position that you need? And some of us, and to some extent, we're guilty of it. Lapsed salary dollars we do convert to operating, or to help buy equipment, things like that. When we don't have a position that's filled, we don't do that by intent. Not saying other department heads do, but there are some departments that have large numbers of chronically unfilled positions. That's all funding that gets budgeted and to some extent becomes a slush fund for that department. So the manager's trying to tighten down some control on those funds so that they don't just get converted to operation during the budget year. I really felt like there was the need to do a restructure in the department. Not a huge, not a like bring in the wrecking ball, tear things down, but there were some things that just didn't seem like they were placed in the right places, or the reporting structure wasn't right for some of those things, and really wanted to do those moves anyways, but didn't feel like we could do that in the thick of COVID. And I'm hoping that COVID is mostly, in the rears now. Still with us, still going to haunt us for a while, but I'm hoping that we're sort of over the hump of COVID and can move towards trying to update some of our structure at the health department. And again, I think we can have a more detailed discussion of this next month. Good news, couple of divisional highlights for you. Allison Swart, who was going to present the satisfaction survey, and Eli Johnson. I'm not sure where Eli is from. I think he might be Parks and Recs. Submitted a proposal on our Parks app, and will be attending the Shift Summit. So I guess they're off to Colorado come October of this fall. So that's some good news. And then Robin, never short for words. I'll give you a minute to kind of look at Robin. Robin, if you're listening, thank you for your bullets. But WIC has been busy. August is Breastfeeding Support and Education Month, and we are having a World Breastfeeding Celebration again this month in person this year. Still, some of our staff are a little reluctant to do some in-person things, but we are doing that. And you can see some of the things that she's talked about with WIC. Here's the second page. We're going to be restarting our breastfeeding classes in October. These will be in-person classes. The WIC waivers, which have pushed a lot of WIC enrollment into the virtual realm, are in place through at least January of next year. And Robin and I were talking about that earlier this week, and I said, Robin, how are we ever going to get these folks that we've done virtual signups with for the last 2+ years to come back to the clinic, to come back to our office for in-person signups? So I think that genie's kind of out of the bottle. I'm not sure how the government's going to be able to put that back into the bottle. We may stay with some sort of virtual sign-up with height and weight checks in person or something. But I think that's going to be a little hard to pull that back and just say, oh, you've got to come in and sign up in person now, when we've been doing these virtual sign-ups for 2+ years. We are planning for what was originally the Polar Express Day, the first year I was on the job here. Yes, you all have been putting up with me for 3 years already. But we're going to have the Jolly Jamboree will be our December holiday festival. The event date will be December 15th. We're going to host that at the Ag Center in the afternoon, and we'll give you more details as we get closer. And then we enrolled, this is a joint Pitt County UNC Chapel Hill program called Med South. It's a diet program that we have enrolled in. We actually have a contract employee who is going to be helping us with that program, run that program as both research and a clinical program. And we did receive a $40,000 grant from ECU Health for the diabetes program. So those are the end of my prepared remarks. Questions, comments, further discussion?
Questions for Dr. Silver now? Thank you, John.
You're welcome. No questions? Kelly?
Look at me.
We were just taking great notes because you had so much information to share. It was very interesting.
Well, thank you, folks. Appreciate your support and your attention. Have a good night, everybody.
Thank you, Dr.
Thank you.
Silvernail. I did want to remind you that there's an education opportunity that you may have received in your email this coming Thursday at 2 o'clock. There's a talk that you can join by Zoom. It goes from 2 p.m. to 3 p.m., and it's from the Association of North Carolina Boards of Health, and it's options for organizing and governing your local health department. And I know Kelly and I are signed up for it, and we'll get it to John and Lauren and ask them to recirculate it in case you want to join that. But just, that's something, a reminder about that. You should have gotten something from the North Carolina Association of North Carolina Boards of Health. Anything else for the good of the order? Any other business for tonight? If not, a motion to adjourn would be in order.
So move.
And second, and all those in favor, any discussion? All those in favor say aye. Any opposed? We stand adjourned. Thank you all.
Thank you.